Hi, I'm Polly Stiefvater with Lord Fairfax Community College, and I am the clinical coordinator for the nursing programs. And I want to take this opportunity to thank you for volunteering to be a preceptor for one of the LFCC students. Just a little bit about the student that you're going to have this spring semester. The individual is going to graduate in May of 2013, so they're very close to the end of their educational journey. And we want to thank you for taking the time to be with them. The purpose of this video is just to make sure that you're aware of the preceptorship program at Lord Fairfax and your roles and responsibilities as the preceptor, and what is the role and responsibilities of the preceptee. So, let's get started. Prior to having the first clinical day with their preceptor, your preceptee will reach out to you and obtain a copy of your clinical schedule, and they will ask for contact information and how to reach you. They will contact you initially via your Valley Health email, or they'll leave a message for you on the unit that you work on, but then you need to exchange cell phone numbers. Once this sheet is filled out, you'll receive a copy of this sheet, and it also has some very important information on it for you, and it has the information of who the point of contact is here at the college for your preceptee. In case you ever have any questions, concerns, anything that you need to clarify, you should have this information right from the beginning. The first day that the student is with you on the clinical unit, there are a few things that you should be given by the preceptee, and these include a copy of the preceptorship booklet, and we will go over these, a copy of the preceptorship clinical agreement form, and a copy, and this is very important, of the clinical's do's and don'ts, the things that the students can do while they're under your supervision and things that the student can never do even when they're under your supervision. Alright, let's just take a minute. This booklet introduces what the preceptorship program is about. It talks to you about the program goals, and it's really just centered towards increasing the student nurse's self-confidence of taking care of not just one patient but multiple patients, and hopefully by the end of the preceptorship, maybe even taking care of an entire team. It's hopefully going to transition them from being a student nurse into a graduate nurse, and it's going to show them a better picture. They'll have a better understanding of what it actually means to be a new graduate nurse and the job responsibilities that they would have. The preceptorship booklet goes over the advantages to the student, and you can read those, the advantages for the preceptor, the clinical agency, and the school. Okay? It talks about the program objectives and the different things hopefully the student will get to be aware of, being an advocate, being a clinician, being able to collaborate with all members of the healthcare team, being an educator, being a leader, and even dabbling in research. It talks about some general guidelines, and it talks about your guidelines too as being a preceptor for the student. Now, student responsibilities, this is very important, and we go over the student responsibilities with the student prior to them starting their preceptorship program. But what you should know is that they've been assigned to you because you worked in one of their three main areas of clinical interest. So they want to be on the floor that you are on. They realize that they have to, within the first 24 hours of having the first shift with you, they are to fax the preceptorship agreement form. The preceptorship agreement form is nothing more than just saying on their first day you received certain information and you had a chance to review that information. And they sign it, you sign it, and then they fax it to me and I will sign it. It talks about contacting you. It talks about contacting you if they are sick and they're unable to make their shift for the day. And it talks about that they're under your direct supervision at all times. And it talks about that includes while they're giving medications. These students are not to give medications independently. Then it talks about the preceptor responsibilities and the healthcare agency responsibilities. And then clinical do's and don'ts. I just wanted to touch on this a little bit. It talks about things that students can never do, even while they're in the preceptorship program. They are never to take physician orders, accept verbal or telephone orders, administer chemo, do venipunctures for laboratory blood specimens, or change TPN, or discontinue or start hemodialysis or peritoneal. Then it talks about things they can do observation only, and then it talks about things that they can do with you hands-on. So it's very important that you keep this with you at all times during their preceptorship so you understand what the student can and cannot do. I just want you to know that we at Lord Fairfax are here to answer any questions or address any concerns or issues that you might have with your preceptee during the time that they're with you. You'll receive a letter on the first day also, and the letter actually talks about how we're regulated by the State Board of Nursing, and it gives you at the bottom of the page the contact information for the preceptee's advisor. So at any time, do not hesitate to contact us. And also know that a couple of times during the preceptorship experience, the preceptee's advisor will actually stop and check on them and to make sure that there's no issues, any concerns, anything that needs to be communicated. Also in the envelope that you'll get on the first day, there are evaluations. And these evaluations are done by you and the student. And the evaluation in your envelope is for you to fill out, and it will actually evaluate the student's performance and ask you for an opinion of the preceptorship program, and we highly value this. We've taken many suggestions into considerations over the years and tweaked the program. Also in your envelope will be a envelope that has a stamp on it already, so all you have to do at the end of the preceptorship is to just fold it up, drop it in the envelope, and put it in the mail. And if you would actually like a copy of the evaluation the student does on your performance as far as being their preceptor, please don't hesitate to contact me via my email, and I'll be glad to get you a copy. I just again want to thank you for taking the time to actually spend with our students here at Lord Fairfax, and know that we're here if you have any questions at all, any concerns. Thank you.